I'm joined now by Dr. Kate Tulenko. She's the founder and CEO of Covus Health. Thank you very much for joining us, Dr. Kate. Now, firstly, it seems that, many parts of the world have already had their Omicron surge, are coming down off the back of it. Why is Hong Kong getting theirs now?
Well, Hong Kong surge is so late because it did have a very good zero case policy. But unfortunately, somehow Omicron got through that barrier and has gotten into the general population. In the past 2 weeks in Hong Kong, we've seen a spike of over 821% increases in new cases. And another thing to keep in mind for Hong Kong is Hong Kong has a much older population than the rest of the world. About 18% of its population is above the age of 65, compared to about 10% for a country like India. And we know that elderly people are much more vulnerable to catching COVID and getting more severe COVID, even if they are vaccinated. And Hong Kong has a vaccination rate about 82%, which is quite good.
Now, would you describe this as Hong Kong's exit wave, a final surge in cases, if you like, before the virus becomes endemic, as in manageable without any major restrictions?
Well, a number of experts have warned that the end of the Omicron surge is not the end of the pandemic, that there may be no exit wave because we don't know what's the next variant to come around. Might be a variant that's either more infectious than Omicron or more deadly than Delta. So that's a real concern. So Hong Kong has to continue to keep its stringent measures, to test regularly, to isolate people who are positive, and to continue the social distancing controls.
You mentioned the COVID zero strategy that Hong Kong's been using, much like the mainland. Why is it that Hong Kong seems to have been susceptible for a much stronger surge in the way that the mainland has managed to avoid? Is there any specific reason to that?
I think there are two reasons. One is that Hong Kong does not have the same resources that mainland China has. And so we see that mainland China is now, providing the kits, the masks, the medicines, and the human resources, the health workers, to help Hong Kong. Another reason is that, Hong Kong, of course, has a different history as far as people's, ability to go out and about and do what they want. And I think because of that, it's been a little bit more difficult to enforce some of these social restrictions. And we do know that a number of businesses in Hong Kong really have been negatively affected, financially by, the lockdowns. And so there's been a lot of pushback against that. So I think that's the second reason why we're seeing more of a surge in Hong Kong than in mainland China.
We're expected to hear from Carrie Lam about this latest surge. What measures might be the most effective in your eyes at this point?
Well, right now, I mean, the challenge is that the virus has gotten into the general population. I know that they're trying to shift resources away from, isolating children who are positive and instead keeping them with their parents so that they have more resources to treat those who are sick and more resources to do wider testing. I think that testing and the early identification of new cases is what's going to happen. There probably is a limit on how much they can enforce the lockdowns, as I mentioned previously, but certainly much more can be done in identifying and isolating those cases as quickly as possible.
Okay, that's all we have time for. Thank you very much for that. Dr. Kate Tulenko there, CEO of Covus Health. And as I mentioned, we'll be hearing from Dr. Carrie Lam, in the bulletin, so we'll have those details.